بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about the globe calcification. Globe calcification are related to deposition of calcific hyaline-like material at the surface or deep within the optic disc. We call this diffusion bodies, and it is commonly bilateral, while choroidal osteoma tend to be unilateral. Here, this is axial CT scan of patient. We have calcification in the posterior aspect of the left globe consistent with choroidal osteoma, and as we said, choroidal osteoma tend to be unilateral. Here is another patient with bilateral calcification of the uh, optic head of the optic nerves, and we call it adhesion. Adhesion are usually bilateral, and it is located at the level of optic nerve head, and it is found in about less than 1% of patient of population and may be familiar. When adhesion it is deep, may be elevated the margin of optic disc and appear on ophthalmoscope and mimic papilledema. Usually those discovered incidentally and occasionally cause permanent or episodic visual defect may be present. But choroidal osteoma usually, as we said here, this patient with choroidal osteoma, and the choroidal osteoma usually located distal to the optic disc and are more common in patients with tuberous sclerosis. Choroidal osteoma usually, as we said, unilateral and cannot be differentiated from more common idiopathic subchoroidal calcification. Here, this is a patient with bilateral calcification of the globes, and the globes are small, and this is what we call it phthisis bulbi, and this is the end result of the severe infection or inflammation or traumatic process to the eye, leading to shrinkage and calcification of the globe. Phthisis bulbi, as we see in this patient with bilateral calcification of the both orbits. Sometimes, as we see here, there is calcification at the insertion of the left medial and lateral recti muscle, and this is tendinous calcification of the extraocular muscle, can be unilateral and can be bilateral and seen in older patients. Here, this is a patient with calcification of the right globe, and this seen in tumor, and this is retinoblastoma of the right globe. And another patient with mass in the left globe with enlargement of the left globe, and we see some calcification in the left. Also, this is another patient with retinoblastoma, but mostly of the retinoblastoma are non-calcified. We see also disorder of calcium and phosphorus metabolism may also cause ocular calcification. Radiation, one of the causes of the globe calcification, especially the lens, and also occasionally choroidal angioma may calcify. This hoping you this is another patient with bilateral retinoblastoma with calcification, and thank you for listening. Hoping to see you soon in another topic.